So, post traumatic stress disorder, or PTSD, is mentioned pretty often in social media. And while the ability to share experiences to help reduce stigma and to inform the general public might be positive, the way PTSD is portrayed online could be more accurate. And we definitely want to promote more understanding. Hi, I'm Michelle Young, licensed clinical social worker with Mental.Health.Merienda.
And I'm Dr. Adeline Leon, licensed clinical psychologist. So a few ways that PTSD is misrepresented in social media, and there's lots of them. But one is social media posts and memes. Lots of times they really oversimplify PTSD. And if you saw our video on symptoms of PTSD, you could see that it's really complex. There's a lot of nuance in it. And when you're making a video on TikTok that lasts 2-3 minutes, or a short on YouTube that lasts a minute, you just don't have enough time to get into all those complexities and all those nuances and the wide range of experiences that people have when they have PTSD.
Yeah, and another problem with social media is misinformation. So social media is flooded with a lot of unverified accounts or people just sharing personal anecdotes. So you're not hearing from someone who is, a qualified mental health expert. So sometimes what people are sharing, it's not really backed by scientific evidence or any professional experience or expertise. And that can lead to a snowball effect of just widespread misinformation and sometimes potentially harmful advice.
Another one is that social media posts, they can really perpetuate harmful stigmas and misconceptions about PTSD. And I think it's that for social media, really the goal is to get views. And a way that you get views is to make things more dramatic, sensationalize them. And in doing that, sometimes people with PTSD can be portrayed as unstable, as violent, as dangerous. And those inaccurate representations, they reinforce prejudices, and they make it harder for people to admit that they're experiencing this and to go and seek help and support.
Yeah, and related to that is sometimes, and maybe it's not intentional, but sometimes the content, because again, you want views, you want it to be quick, it can inadvertently trigger or re-traumatize people who do have PTSD when they see some of these videos. So if there's anything graphic or any insensitive content, even though maybe you didn't mean to offend anybody or you had good intentions about sharing your video, it can have that unintended consequence of hurting somebody, again, re-traumatizing them, and it could really negatively impact someone who's already struggling with this condition and just make it worse for people who are suffering.
So I think what we're trying to say with this video is to really watch out for misinformation about PTSD. Instead, make sure that you follow and support accounts that provide factual PTSD information and education from qualified, licensed mental health professionals like ourselves.
So tune into our other videos to find out more about PTSD as well as other mental health conditions. Thanks for watching.
Bye.